I'm happy to report that my dog is healing pretty well from her cancer surgery. Her stitches have been removed already. She still seems to have a little muscle pain when getting down from the couch or bed, and makes cute little barks for help, but otherwise is doing well. Welcome to CognitionChunks. This information is for entertainment only. I am not medically trained. Is this useful? Is this nonsense? Join me as I attempt to learn from GPT. Here is Canine Spindle Cell Carcinoma Information by GPT. Episode 2. Understanding canine spindle cell carcinoma versus other types of carcinomas.
Understanding canine spindle cell carcinoma in the context of other types of carcinomas involves grasping the differences in origin, cell types, behavior, and treatment approaches among various carcinoma and sarcoma types. Carcinomas and sarcomas are both categories of cancer, but they originate from different types of tissues. Canine spindle cell carcinoma. Origin: spindle cell carcinoma is a type of soft tissue sarcoma. Despite the term carcinoma in its name, it arises from mesenchymal, connective tissue, rather than epithelial cells. The spindle cell descriptor comes from the elongated, spindle-like shape of the tumor cells when viewed under a microscope. Tissue affected: connective tissues, which may include dermal or subcutaneous layers, muscle, fat, or other supportive tissues. Behavior: these tumors are locally aggressive, meaning they tend to invade nearby tissues. However, their rate of metastasis, spreading to distant sites, varies and can be less common compared to some carcinomas. Diagnosis: typically involves biopsy and histopathological examination to identify the characteristic cell shapes. Treatment: mainly surgical removal, often with wide margins to ensure complete excision. Radiation therapy may be used in cases where surgical margins are not clear, and chemotherapy might be considered for metastatic disease. Other types of carcinomas in dogs. Squamous cell carcinoma originates from squamous epithelial cells, often in the skin, but can also occur in the mouth, throat, and other areas. These tumors can be locally invasive and have variable metastatic potential. Basal cell carcinoma arises from basal cells at the bottom layer of the epidermis. Generally, these are less aggressive and have a low risk of metastasis, making them more amenable to surgical removal. Adenocarcinoma originates from glandular epithelial tissue, often affecting organs like the mammary glands, prostate, or gastrointestinal tract. These cancers can vary in aggressiveness and potential for metastasis. Key differences: tissue origin: spindle cell carcinoma, mesenchymal, connective, tissue. Other carcinomas: epithelial tissue. Cell type: spindle cell carcinoma, characterized by spindle-shaped cells. Other carcinomas: cell shapes and characteristics depend on the epithelial tissue of origin, such as squamous or glandular cells. Behavior and metastasis: spindle cell carcinomas are known for local aggression but vary in metastatic potential. Other carcinomas, especially certain adenocarcinomas and squamous cell carcinomas, may have a higher likelihood of metastasis. Treatment approaches: surgical removal is a common approach for both spindle cell carcinomas and other types of carcinomas. The use of wide margins is particularly emphasized in spindle cell carcinoma due to its local invasiveness. Radiation and chemotherapy might be more commonly considered in other types of carcinomas, especially when there's a significant risk of metastasis. While spindle cell carcinoma shares the carcinoma term, its characteristics align more closely with sarcomas due to its mesenchymal origin and the type of cells involved. Understanding these differences is crucial for appropriate diagnosis, treatment planning, and prognosis estimation in canine cancers. Each type of cancer requires a tailored approach based on its unique properties and behavior, emphasizing the importance of accurate diagnosis and specialized treatment strategies in veterinary oncology. Thank you for joining us for another Cognition Chunks. Please like and subscribe.